So today I'm just briefly going to touch on reviewing preoperative blood ordering practices and to give you an example of where I've assisted one of the private hospitals in making some sustained changes in this area. So in the private sector, from the transfusion laboratory, a pack of red cells on average is issued 4 times before it's actually transfused. Thanks, Linda from HealthScope, for this information. And it's not unusual for this to actually occur up to 8 times. So this means that a bag of red cells are sent out from the laboratory, receipted by the hospital, signed into their blood fridge, and stays within that hospital blood fridge from anywhere up to 3 to 5 days on average. And then when it's not required, it's sent back to the laboratory, and this is repeated again. So for this to occur, as Rick and Merrily have already talked about, a lot of the quality processes that need to, it's not as simple as sending it out and sending it back. The transfusion laboratories need quality information to ensure that when the private hospitals have received this blood, that they've looked after it. So the hospitals have got the responsibility to manage the products safely, to ensure their blood fridges meet Australian standards, and that they do all the quality work. And the laboratories need this more than just a verbal assurance. And Blood Moves has helped with that now in the metropolitan sector by assessing all of the private fridges in the metropolitan area and providing them with a gap analysis against the Australian standard, and also by helping facilitate the movement of this quality information back to the laboratories. So there's up to 5 different transfusion providers that could be accessing a hospital's blood fridge and saving the hospitals from having to share this information with all 5 of them. Blood Moves has now worked out an efficient way of just sending this information to one of the laboratories and helping the laboratories share this information so that they know that that fridge and that hospital it's fine to receive their blood back. So why should we review red cell pack movements in the hospitals? Before, we heard that 71% of the red cells wastage was due to it reaching an expiry. And when you think about the red cells sent out to the private sector and you're hanging on to them for sometimes 3 to 5 days, we're adding to that problem. Standard 7 calls for the hospitals to be doing action around efficiently using this resource, and I've just listed the criteria there. It's important that the hospitals help the laboratories with managing their inventory efficiently. At the moment, a lot of the private laboratories will have to work with an artificially inflated inventory because their product sits out in the remote blood fridges for some time and is not accessible to anyone else in this period of time, and they're usually unaware whether or not it's going to be used or not until they get a call to come back and collect it. For the hospitals, it's also a patient safety aspect. If your remote blood fridge is full of red cells, there's more chance that you're going to pull out the wrong pack of blood and give it to your patient than if it's only got the blood in it that you're likely to need. There's a huge workload included for the private, usually nursing staff. I see many of you here today who have to look after the blood fridge in the private sector. Often falls with recovery staff because the fridges are usually located there. So the recovery staff usually are the ones who have to receipt it in and do the daily checks on the fridges, but also do the daily stock checks and contact the ward areas to see if the blood is still required before working out whether they can send it back to the laboratory. And I guess besides why we should also be reviewing what's coming into the hospital is to make sure that the patients who do actually need blood do have it there. So it's most of today I'm talking about a case study where we reduced the blood that came into the hospital, but it's also important to assess that patients who do need blood do have it in a safe and timely fashion, and cross-matches aren't taken or being processed while the patient is in theatre or leaving theatre. So this case study I'm going to talk about today is from Burnside Hospital, and some of you are here today who are involved in that. And it's from a couple of years ago that post their accreditation process, they had a surveyor who was very switched on to blood, and while they were surveying the hospital, asked to see the hospital blood fridge register, and from a quick glance that surveyor noticed that they get a lot of blood in, don't use it and send it back, and they asked the hospital to look into this. So the hospital did an initial audit and found that 60% of the red cells that came to their hospital was sent back. And then they looked at that. This was predominantly for the orthopaedic joint surgery. So they contacted me and for some assistance, and with one of their theatre clinical nurses we did an audit, a simple audit. We looked at the 3 orthopaedic surgeons that they had at the time. This is from a few years ago, so they have changed now, some of their surgeons. But we looked at the surgeons, we looked at what procedures they were doing. We did 5 knee replacements and 5 hip replacements, and we looked at the preoperative testing that was done on these patients to see whether or not they had a group and save, or if they were cross-matched, and if they were cross-matched, how many units they were. We did look to see whether or not the patient was transfused and what day they were transfused, and how long the red cells stayed in the hospital for. So from this, when I did the slide, I typed in overall it was a low transfusion rate, and then last night I just checked the data, and actually there was all the 3 surgeons had a 0% transfusion rate for the joints that we looked at. They were fairly small numbers that we audited, but we compiled a report. In the report, we just de-identified the surgeon so they could have this information to know what their practices were. We provided other information specific to that hospital, such as the turnaround times for how quick they could get blood if they didn't have it for all of the different pathology providers, because it's unusual that you'll get 3 surgeons that are using the same pathology provider in a hospital. And we also provided the information about what emergency O-negative blood stocks that hospital had, which varies between each hospitals that their anaesthetists go to as well, so it's important that they knew that information. From this study of the 3 orthopaedic surgeons, one was doing 3 units for knees and 3 for hips, one was doing 2 for knees and 2 for hips, and the 3rd surgeon didn't necessarily have a pattern, sometimes grouped and saved, and it obviously was just assessing each patient individually. Just having this information and a good rapport, the theatre staff presented this information to each surgeon, and one surgeon, as soon as they saw the information, changed their practice on the spot because they didn't actually do the preoperative ordering, and the practice manager did. So they knew that they had a low transfusion rate and were quite surprised that they were having 2 units come in. So that saved estimated between 200 to 300 units per year coming into that blood fridge just by presenting the surgeon with the information. The other surgeon that was doing 3 units for their knees and hips didn't feel the need to change. Some of the information, I guess back on the change, that hospital has still continued on auditing. And so they constantly look at what's coming into their fridge and report it to their perioperative committee. And I've heard that their last, in August, when they did an audit for August, they only had 17 units that came into the fridge and 17 units were transfused. And previous to this, a few years ago, they were getting upwards of 60 to 80 units a month coming into their fridge. So when you think it's usually the recovery staff that are signing it in and they're daily checking and then ringing the ward for each unit of pack to follow up to see whether or not they need to send it back or keep it, it's reduced the workload significantly and cut back on just the blood sitting there inefficiently. This is just a template of a form that some of the private hospitals have that I've helped develop. Each private hospital, most of them don't have a transfusion laboratory on site and work with a remote blood fridge. And it's important that when an anaesthetist, because most of their anaesthetists go around to all of the hospitals, when they're operating at that hospital, they know specific information for that hospital. So this is laminated in their theatres. The hospitals write to all the different pathology providers and ask them to provide information on how long it will take them to get red cells to them when they've got a current group and save, how long would it take to get red cells if they didn't have a current save, and what other and the other products as well. It's got information about what emergency O-negative blood they hold in the hospital as well, and what other impress they may have in there. This form originally came about for in another private hospital when they had an incident where a patient, elective surgery was late in the evening and had an unexpected bleed. They were group and cross-matched with one pathology provider who provided the red cells. When they sort of got needing other products other than red cells and contacted the laboratory, it came as a bit of a surprise to the team that laboratory didn't stock other things than red cells. And they did have a relationship with another laboratory that would supply other products to them, But at 10:30 at night, they just decided to swap and go with the group that had the emergency O negative blood at the hospital. So from that, we learnt that it's really important that also you know what the transfusion provider holds and what they can provide for you. So if you're wanting to have a look at this in your hospital, and I guess this is mainly relevant to private hospitals that are working with a remote blood fridge and not when there's a transfusion service provider on site. You need to engage your stakeholders such as the transfusion service providers. So today, they're in the audience, and I'm sure if you went up and spoke to them, they'd already in their head have no information that they could quite clearly tell you. They're used to patterns of blood that they send out and get back when it's not used, but engage them because then they can at least point you in the right direction of where further auditing is required. Make sure that you keep the surgeons and their anaesthetists involved in the process. Information is really the key here. Some of them, being able to present them with some of the information about transfusion rates and transfusion practices sometimes is just enough to change practice. And it's also very important as well, looking at it to making sure that there is blood when needed, that there's a backup. So if you are going to change any practices, the people involved in making the decision to change do need to have the vital information specific to the hospital that they're working in. But they also, we suggested in the first case with Burnside Hospital, that if you were changing to a group and save, that perhaps you wrote on your request form group and save and cross-match if antibodies are present, just so then if the patient is going to take some time to cross-match, then cross-match blood is available timely and safely if needed. And that was really it for today. I just wanted to thank Burnside for being happy to be identified. Usually private hospitals are when it's a positive outcome. And of course, Catherine for all of her ongoing support. And Blood Moves, that's really helped out the private hospitals with having a resource when something goes wrong with a blood fridge. To having a scientist who's passionate about blood fridges available to provide information is great. And of course, the ongoing support that blood organs and tissues provide to the private sector by having someone like myself to help them with transfusion safety management. Thank you.